Hey Elizabeth, how have you been? Good to see you. How's your new job going?
Hey, Stephanie, I'm really enjoying it. Hey, it's been really challenging, but it's very rewarding. I'm working at Carenet Health now, and it's a healthcare only call center, and I'm really excited about it.
What exactly do you do there?
So, I'm an RN care advisor, and so it's a telephone triage nurse position. We assess patients' health concerns over the phone. It's like bedside nursing assessments, but we can't see or touch our patients. We guide them towards the most appropriate level of care based on their symptoms.
Tell me a little bit more about CareNet.
So it's a healthcare only call center setup, and we've actually been in the healthcare center and clinical experience business for over 30 years. 1 in 4 Americans have access to our services, and we take about 1 million nurse triage calls a year. We're a 24/7 operation, and we help to direct patients to the safest level of care. We even help them avoid unnecessary emergency room visits sometimes.
How do you make accurate assessments without seeing patients?
It is challenging, but we follow symptom-based protocols and we use our clinical judgment to ask the right questions, gather essential information. Obviously, communication is key, and we've got to be able to convey medical advice clearly and empathetically, especially to anxious, distressed, even frustrated callers.
What skills are essential for this role?
Excellent communication and interpersonal abilities, strong clinical judgment, superior customer service skills, and the capacity to remain calm under pressure are crucial. Empathy, patience, and multitasking are also essential, and we need to be comfortable talking, typing, reading all at the same time.
How is your work environment set up?
Well, I have my own office space. I have a door that closes and locks. My family knows that they can't come in my office when I'm working. My dog Harry does come with me from time to time. He can't talk, so there's no HIPAA violations there, right? I do have my desk, comfortable chair. My desk is set up beside a window so I can see outside. I enjoy that. It's really quiet in here. I do have a routine before every shift. I make my coffee, I fill up my water jug. I like to stay hydrated. I keep snacks in my drawer in case I get hungry before it's time for a break or my lunch. We do have 15-minute breaks twice a shift and a 30-minute lunch. Those are scheduled for us, so that's nice.
I was thinking you had a little bit more autonomy since you work from home. Are you telling me you can't go do laundry or housework while you're at work?
No, not at all. It is like shift work, so I clock in and I clock out. I did make a lot of effort to make my office somewhere that I like to spend time because I'm in here for 10 hours a day. My shift is pretty long. I can't do housework in between calls. We get back-to-back calls, and I have to be at my desk and ready for every call that comes in.
Just describe like a typical shift to me.
So in a typical shift, 8 to 10 hours, we're going to take around 40 to 50 calls in that shift. It averages out to be about 8 to 10 minutes per patient. And like I said, the calls can be back to back sometimes. We use our symptom-based triage guidelines that helps us to assess and provide directions on the safest and most appropriate level of care. Active listening is crucial because we document everything during the call. We're also monitored for quality purposes. All of our calls are recorded. And we also have performance expectations like any other job. In this role, it's things like average talk time, adherence to your schedules, attendance, quality audit scores, just to name a few.
Do you get any support during your shifts?
Oh, absolutely. So we have managers, supervisors, and charge nurses that are available around the clock for assistance. We also stay connected through instant messaging and virtual meetings. We have team meetings from time to time. That's pretty neat. We meet with our direct manager, supervisor 3 to 4 times a month to review our progress. They answer questions and just provide support.
Now, what about licensing? I imagine you take calls from all over the country.
Yes, we do. So we all have compact licenses, but we are expected to apply for additional non-compact state licenses. California is a big one. It's required for everyone. It's mandatory. The application fees can be advanced on our paycheck. That's really nice. And we do get a $40 bonus for each new successfully activated license. But Carenet does recoup the fees if you leave for any reason.
So, I mean, it sounds a little demanding, but very rewarding in this job. How are you finding it so far?
It is demanding, but it is very rewarding. I'm really enjoying it. The leadership is very supportive, and I feel like I'm making a difference in patients' lives. Transitioning into this role has had its hurdles, but it is fulfilling to help people to get the care that they need and the appropriate care that they need. I won't lie, it is pretty nice having a 15-second commute.
But do you ever miss working side by side with code workers?
It's an adjustment. It's not for everybody. I do know some nurses that miss bedside and they miss that face-to-face interaction, and they do decide that it's just not the right fit. But we have a communication system set up where you can connect with your fellow nurses on shift. We even have social meetups from time to time, so you get to see your coworkers in person.
So tell it to me straight. What is the downside to this job?
Every job's going to have its downsides. Like I said, it's been a transition, getting used to being at a desk job. I do have to be intentional about physical movement. I got to get my steps in. I try to keep my nutrition in check and stay hydrated. I actually pack my lunch either the night before or before I start working every day. I like to have something prepared that's quick and easy so that I can enjoy my whole break and not be rushed trying to figure out what I'm going to eat every day. Something else that's been kind of hard for me is handling the difficult callers. There's times where people call in and they're frustrated, they're upset, they might even be angry, and they can say some pretty harsh things, but we are trained on how to manage these calls and they support us through that.
Well, I gotta say, I'm really impressed, and I think I might be interested. How do I apply?
Awesome, I would love for you to come work for us. Let me show you, it's really easy.